Hi, this is Professor Sarah Sears. Today we're going to go over the health assessment checklist. So we will get started here. So first things first, knock, knock, knock. Hi, my name is Sarah. I'm going to be your nurse today. Can I come in the room? I'm doing hand hygiene. So Mr. Jones, I'd like to go ahead and do a quick health assessment. We will do some vital signs, listen to your heart, your lungs, your belly, and just kind of see how everything's going. Should take probably about 15 minutes. Would that be okay with you? Great. So I'm going to, at this point, make sure I provide privacy for my patient, close the curtain, close the door. Mr. Jones, can you please verify your name and birthday for me? Okay, and his armband matches what he said. And do you have any allergies? No, great. Mr. Jones, on a scale from 0 to 10, are you having any pain right now? So if he says none, then I'm done. But if he tells me he does have pain, I have to go into a PQRST assessment. So, okay, you have left ankle pain. Does anything provoke it or make it better? Can you describe how it feels? Does it radiate anywhere? He told me the severity already. And then when does it start, or when do you notice it? Perfect. So the next thing I'm going to do is my general survey. I'm looking at him. He appears to be his stated age. I don't see any signs of acute distress. His facial expression is calm and relaxed. The mood and affect are also calm. His speech is clear and intact. His dress is appropriate for the season and the weather. And then he does appear to have good personal hygiene. I don't notice any body odors. So at this point, I want to assess his level of consciousness. He does seem to be alert, and orientation. So can you say your name for me? Mr. Jones, do you know where you are? Can you tell me what today's date is? And then can you tell me why you're here today? And he answered all of those correctly, so he would be alert and oriented times 4. I don't see any visible devices like walkers, canes, any prosthesis, or any hearing aids. The next section would be taking a set of vital signs. I can't do that here for you guys, but temperature, pulse, respiratory rate, and pulse oximetry level. You'll do blood pressures next term. Next, moving on to the skin. So I want to just generally look over his skin and see how things are. So the color is within normal limits for ethnicity. I don't see any lesions, although we could categorize this kind of abrasion here for him. Wounds or incisions. He does not have any piercings that I can see. I want to check his skin temperature, so I would normally take the back of my hand, put it on his arm, so dorsal aspect. Skin is warm and dry. I'm going to check his skin turgor, so you're pinching the skin to see and let go. He does have good elastic recoil. I'm going to ask him to show me his nails. So I'm looking at the nails. The nail bed is pink. The nails are rounded. I'm going to assess for signs of clubbing, so the contour. So go ahead, put your fingers like this, and then go ahead, put your fingers together like this for me. So there's no clubbing present. And then I want to go ahead and check for capillary refill. So I'm going to push down on the nail bed so it blanches, and I let go. 1 Mississippi, 1 second, brisk capillary refill. The next part, I'm going to go ahead and assess the face. So I'm looking at his face to see if it is symmetrical, and it does look symmetrical on both sides. I'm going to inspect and palpate the head for any lesions. I don't see any. And I'm parting the hair. I don't see any signs of infestations. I'm also looking at the trachea. It appears to be midline. And then I'm palpating his neck. I don't feel any masses. Moving on to the eyes, I'm looking at the external ocular structure. I don't see any discharge redness, and there are no lesions on the eye. I'm also going to be looking at the eyebrows, eyelids, and eyelashes to see if there are any lesions or infestations. Next up, I need to inspect the conjunctiva and sclera. So I could either ask the patient to pull down his eyes and look up for me, or I can take my thumbs and I can pull down and have them look up. And the conjunctiva down here is pink. The sclera is white, and those are normal findings. Next up, I need to assess his pupils. So this is where I'm taking my pen light. Hopefully you have one with a gauge on it. I don't, but I'm holding it up, and I'm looking at the gauge and measuring the size of the pupils on each side. So I've got to measure bilaterally. So we'll say his eyes are 3 millimeters, and they're both equal because they're the same size. And when I look, they're round. Next up is reactivity to light, so we need our pen light. I'm going to go ahead, have him look at me. So I usually say, look right here at my nose. I'm going to shine a bright light in your eyes. Okay, pupils are briskly reactive to light. We could do direct and consensual if you wanted to. So direct, I shine the light in this eye, I look at this eye. Consensual, I shine the light in this eye, but I look for this one to constrict. So we could do both. So at the end, tell me your findings. So pupils are equal, round, reactive to light, and accommodation is the last part. So Mr. Jones, can you look at the wall all the way over there? And now look at my pen light close up. What I'm having him do, his eyes should converge towards midline and the pupils should constrict. So if I look at the wall far away and then I focus here, hopefully you can see how my eyes come together. You may not be able to see constriction from this angle. All right, the next part, I'm going to go ahead and look at Mr. Jones's ears. So I'm looking at the external structure here. I don't see any piercings on his ears or any lesions. The next part is that I need to look in the external auditory meatus. So we can pull the pinna up and back because he's an adult, so I'm pulling up and back and I'm looking in that external ear canal. I don't see any signs of discharge, swelling, or redness. And then I need to do a whispered hearing test. So I would stand 2 feet behind my patient. I ask my patient to occlude his ear by pressing in on the tragus. Okay, so he covers his ear. And then I'm going to whisper 3 random numbers or letters. So XKT. And then he says back XKT. Okay, go ahead, switch ears, cover this ear. He covers his left ear. And I say 27W. 27W. And he passed the whispered voice test. He got 6 out of 6 correct. They need a minimum of 4 out of 6 to pass. All right, next up, we are moving on to the nose. So again, I'm inspecting the external structure. I'm looking for any lesions to see if the nose is midline on the face for position. And then is it symmetrical? Do the right and left sides look the same? And they do. Next, I need to inspect the internal structures. So I'm going to have my patient look up. You could also pull the nose up if you needed to, but for this one, we'll just look. So I'm looking in the nose. I don't see any deformities, no asymmetry, septal deviation, and no signs of inflammation. Next, we're going to have him do bilateral patency. So I'm going to ask my patient to occlude one side of their nose, breathe in. Good, and then occlude the other side, breathe in. Good, and if you can hear them breathing through both sides, we have bilateral patency. And I don't see any signs of drainage for him. Moving on to the mouth and throat. So I'm inspecting the lips. They are pink, they are moist, they're not cracked or chapped. I'm inspecting the tongue. So I need my pen light for this one. I can ask him to say, open your mouth, stick out your tongue, say, ah. So I'm looking at the tongue when I'm looking in. It's pink and moist. I can also have him show his teeth so I can see the gums. And the gums are also pink and moist. I'm looking at the buccal mucosa, which is the inside of the cheek here. It's pink and moist. And then I'm looking at the palate, so up at the roof of the mouth, to see if the palate is pink and moist. I'm inspecting the teeth to see if they are straight and aligned and there aren't any missing. You can also note the color is white. I need to inspect the pharynx. The pharynx is the back of the throat. We could also include the tonsils here. We're looking for redness and drainage. So this is where it's important to really have them say, ah. You may need to use a tongue blade to move the tongue out of the way so you can see. So, ah. And you can kind of see back there. So pink and moist, there's no redness or drainage. Those are the 2 we're looking for. All right, the next part is moving into our lung assessment. So looking at our patient, I don't see any signs of accessory muscle use. Remember, that would be if they're like using extra muscles to breathe, or we see like in kids like tracheal tugging here, retracting, or they're like head bobbing, grunting. So I don't see that. I could also take this time to inspect kind of the shape of the chest. So I'm looking at the chest. I'm looking to see if there's any scoliosis, which is the lateral curve. So I'm looking at both sides here. I'm looking from the side. Do I see any kyphosis, which is like the hunchback, like the dowager's hump. I'm looking to see if there is any lordosis. So that's where they have sway back. That lower part of the back leans really far forward. So it's normal. I don't see any abnormal curvatures. I'm also looking at the AP compared to the transverse diameter. So the AP diameter across the chest, or I'm sorry, the transverse diameter across the chest should be greater than the anterior to posterior diameter. If they're the same, then we have barrel chest from COPD possibly. All right. The next part, I'm going to go ahead and listen to my lung sounds. I'm not going to put this in my ears because it always hurts my ears while I'm talking, and I will inevitably bump it, but listening here. So I'm going to go ahead and listen to my different lung spaces. You need to identify. Helps me to stand on the same side of the patient. So I'm going to start here, right upper lobe, left upper lobe, left upper lobe. There's no middle lobe, remember. Right middle lobe, right lower lobe, left lower lobe. Okay, lung sounds are normal, no wheezes, no abnormal lung sounds, clear throughout. Next, I'm going to go ahead and listen to the back. So I'm going to start here with my left upper lobe, right upper lobe, right lower lobe, right lower lobe, or I'm sorry, left lower lobe, left lower lobe, and left lower lobe. Okay, lung sounds are clear throughout, no adventitious lung sounds. Next, we're moving on to cardiac. The first thing I need to do is palpate the carotid pulse. Okay, so you can find it on yourself right here, kind of that groove next to the trachea. So I need to check both. Okay, and we'll check the other one. You only check one at a time. And then grade it for me. So normal is 2+. So is it 2+, regular pulse? All right. The next thing we have to do is look for any JVD. So to do JVD, it'd be best to lay them at a 45-degree angle, turn their head to the side, and then you're shining the light across. This is a muscle here, but I'm looking in here to see if there's a vein popping up. I don't see any JVD on my patient. All right, so now I'm going to go ahead and do my heart sounds. I have to listen with both sides of the stethoscope. So here's his clavicle. So I go 1, 2 rib spaces down. This is my second intercostal space, right sternal border, aortic. Second intercostal space, left sternal border, pulmonic. Second intercostal space, or I'm sorry, third intercostal space, left sternal border, Erb's point. Fourth intercostal space, left sternal border, tricuspid valve. And then fifth intercostal space, midclavicular line, left side. This is my mitral valve. This is my point of apical impulse. I would listen here to assess my heart rate. All right, and then we go back through with the other side. So once you flip it to the other side here, you don't have to tell me again, but you still have to put in the correct spaces, okay? All right, the next part that we need to do is palpate my radial pulses. So on yourself, you can find these. Okay, so it's on the thumb side in this little groove right here. We're going to compare both at the same time, and you're going to grade your pulse again. So hopefully they are 2+ normal. All right, the last part here is to do my closure. So I want to ask Mr. Jones, are you having any pain right now on a scale from 0 to 10? How would you rate your pain? He says none. Is there anything I can do to make you comfortable? He declines. I make sure that the bed is in the lowest position, the side rails are up, an appropriate number, and that the bed is locked. So my safety checks. I make sure he has his call bell. Mr. Jones, thank you so much for letting me do your assessment today. I'm performing hand hygiene again, and that is it.